Still trying to figure out your schedule for the fall semester? Consider registering for PUBH A203, Investigating Disease Outbreaks and Epidemics. This is a new course at OCC, perfect for students who like epidemiology, the impact of infectious disease, outbreak investigations, disease epidemics, public health practices, and data analysis. Course topics include tools used by epidemiologists, including new technologies, historical roots of epidemiology, case definitions, ethical issues, outbreak interventions, social justice aspects of epidemics, measuring death and disease, such as risk ratios, incidence and prevalence, and the investigation process. So what are some reasons we investigate disease outbreaks? One reason is to identify and eliminate the source of an outbreak. We can also find ways to prevent future outbreaks. Investigations help us evaluate our prevention strategies. We can also learn information about new diseases and get more information on existing diseases. Lastly, investigations help us address concerns that the public might have in response to an outbreak. So what are some well-known outbreaks and epidemics that could be case studied in this course? Perhaps the measles outbreak at Disneyland. In 2014, an outbreak of measles began at the Disneyland Resort, resulting in 147 cases in multiple states, in addition to Canada and Mexico. The majority of infections occurred among those who were unvaccinated or had unknown or undocumented vaccination status. Norovirus outbreaks on cruise ships. The gastrointestinal disease norovirus is easy to spread through food, water, and touching contaminated surfaces. While millions of people are sickened with the virus each year, it is especially easy to pass among contained populations like people on cruise ships. Most people who take cruises will not be exposed to the disease or become ill. However, the CDC has implemented the vessel sanitation program to support quick response and reduce the number of people who become sick on ships. So far this year in 2024, the CDC has listed 8 reported outbreaks on American cruise ships with at least 100 passengers with voyages 3 to 21 days long. The Spanish flu. From 1918 to 1920, this pandemic infected about 40% of the world population, which then was about 2 billion people. An estimated 30 to 60 million people died. E. coli at Jack in the Box. Many of the food service practices we have in place now, such as cooking meats to a particular temperature, were put into place as corrective actions following an outbreak of E. coli that resulted in over 700 illnesses, 171 hospitalizations, and 4 deaths. John Snow and cholera in London. Known as the father of epidemiology, John Snow developed methods to trace the source of a cholera outbreak in the mid-1800s, setting up epidemiological practices that are still in use today. So register now for PUBH A208 Disease Outbreaks and Epidemiology. Class begins August 26th. And don't forget to follow us on Instagram at OCC Public Health. Go Pirates and go Public Health!